Congenital heart disease is the most common birth defect, occurring in 8 per 1,000 live births. Approximately one-fourth are critical. Leading cause of death among children with congenital malformations. They can present with varying degrees of cardiorespiratory compromise depending on the particular cardiac lesion in neonates and infants. Typically present in the neonatal period with increasing respiratory distress, poor perfusion, cyanosis, and cardiovascular collapse. Early recognition, emergent stabilization, and transport to an appropriate cardiac care center are crucial. The best outcomes are found when a physical exam is paired with pulse oximetry screening beyond 24 hours of age. Non-cyanotic disease. Oxygenated blood is shunted from the left side of the heart to the right side. This is called a left to right shunt. Atrial septal defect. The atrial septal defect allows some of the oxygenated blood from the left atrium to flow through the hole to the right atrium. The failure of the foramen ovale to close after birth allows this to take place. You'll see here that the foramen ovale is not closed, and so blood is able to free flow. It's usually asymptomatic in children and infants, and it presents with a characteristic murmur that's usually identified when a child is being evaluated by a physician. A ventricular septal defect allows some of the oxygenated blood to flow from the left ventricle through the hole to the right ventricle and pulmonary artery. So again, this is not closed, and so blood is flowing this way. Cardiac output is affected, stroke volume is reduced, and the right atrium and ventricle can enlarge, leading to pulmonary hypertension. In small openings, patients are usually asymptomatic and growth and development are unaffected. In moderate to large openings, patients will experience delayed growth and development, decreased exercise tolerance, and repeated pulmonary infections. Infants and children with ventricular septal defects are at risk for bacterial endocarditis, and moderate and large defects may actually require surgical closure. A patent ductus arteriosus exists when the ductus arteriosus fails to close after birth. Persistence of the ductus arteriosus beyond 10 days of life is considered abnormal. Oxygenated blood traveling through the aorta is shunted from the aorta across the duct to the pulmonary artery, where it mixes with deoxygenated blood. And the workload of the left atrium and ventricle is increased because of additional recirculated blood. Less blood is delivered to the lungs. Symptoms depend on the size of the ductus and how much blood flow it carries. But signs and symptoms may be fatigue, failure to thrive, poor feeding, abounding peripheral pulses, a murmur, and increased work of breathing. If left untreated, it may cause the patient to subsequently develop heart failure. And coarctation of the aorta, which is narrowing of the aorta. You have a pinched or constricted in the area of the ductus arteriosus. So we're going to have restrictive flow in this area right here. May be associated with other cardiac defects, typically those involving the left side of the heart. They may have a handful of signs and symptoms, asymptomatic in most patients.